Boarding rows 30 to 40.
Ladies and gentlemen, once again, good morning to CIHI.
How far do you have to go for healthcare? Down the street? To a hospital in another town? How about to an entirely different province? We're going to hear about the personal costs of going the distance for healthcare. With an important new report by the Canadian Institute for Health Information, it shows that 1 in 11 Canadians admitted to hospital have what's called a high travel burden, meaning there's no clinic, no hospital, often not even roads to get them to the medical care they need, like Paula and her son Noah from Nunavut.
There's not much equipment up north. The nurse in charge retired. We would have to fly down where there's available doctor.
Her young son developed sleep problems, obesity, diabetes, and is partially blind now in one eye. But help was achingly far away from her family, over 2,000 kilometers from her community.
I had to leave my other kids and my family to go get my baby treatment. It was hard.
And there are doctors like Radha Jetty trying to help families of these children who must travel from Canada's north for care at the Children's Hospital of Eastern Ontario, where there's a specialized clinic.
It's very difficult. Inuit children, their families have to leave their home, their support systems, their land, their culture, their families. And so while they are far away from home, we need to ensure that we try to support these families to access the care that they need.
Welcome to the Canadian Health Information Podcast. I'm Avis Favreau, the host of this conversation. A note, the opinions expressed here don't necessarily reflect those of CIHI, but it is an open discussion. And this episode looks at how over 250,000 Canadians admitted to hospital travel hundreds, even thousands of miles at large personal and systems cost. That's just starting to be identified, all with an eye to making improvements for patients and the health system. Thank you so much for talking to us on the podcast, Paula.
You're welcome.
Our first guest is Paula Alorut, mother of 5, but her particular concern is her youngest, Noah. He suffers from several serious medical problems, from sleep apnea that's triggered problems breathing, and obesity that likely triggered type 2 diabetes. He's just 6 years old and weighs over 160 pounds, but is now getting care at CIHI in Ottawa.
Okay, Paula, let's start off with the story about your son, Noah. Can you tell me when you started to notice that he needed more intensive care?
By the time when he was a little 3-year-old, me and my son, 20-year-old son, started to notice that his sleeping is off. He had to wake up Noah here and there because he had sleep apnea, obese, and airway was so small that they had to do urgent tonsils and androids out 2 years ago.
How did you feel when you heard that?
I didn't know what to do because I was going through a breakup with my long-term relationship, which was abusive, and so I couldn't know what to do.
Paula, I'm so sorry. And I understand that you lost another child 11 years ago. It was a boy whose name also was Noah.
He was born premature with very large heart murmur, and he survived 4 years and 9 months. And then influenza flu had him, and he has health problems almost the same way as my first Noah. So it's hard to see if I lose another child, it's just going to be more devastating because he resembles my first Noah so much.
I am so sorry you have been through all of this. I totally understand. You want to do anything you can to keep him healthy and let him live his full life. So when you discovered that your new baby, Noah, was getting sicker, was gaining weight, and had symptoms of not being able to sleep, and he needed help. Was there medical help available near where you live?
I was getting more concerned about Noah's health. I didn't know who to ask, where to go. And then my nurse friend on Facebook, Marilyn, she messaged me on Facebook asking to see if it's okay for her to mention to the doctor on what's going on with Noah's condition. I said, yes, please do, because I I know it for a fact that we have to see the local nurse practitioner first, and then nurse would be sending information to the doctor, and then it would be finally put in the list. But this was urgent, and the doctor was leaving that same afternoon. So I managed to dress him up. I got a ride from family friend, got dropped off, and that's when Dr. Sindhu noticed that it's urgent. We are going Ottawa soon. That was 2 years ago, March, that he was seen up north. And then by April, within a few weeks, we went down here April 17th, 2023. And then they found out that he has sleep apnea and other illness.
Oh, that would have been scary.
Oh, it was really scary.
So, how difficult was it for you to get to the health center? Is it close to where you live?
No, we didn't have no snowmobile or four-wheeler to go to the health center. For me to walk with Noah, it was like 20 minutes. For me to have him on the sled, I would have to dress him up, even though he's not feeling well. Trying to dress him up, it was very hard because he was running out of breath constantly.
Mm-hmm. So, it was physically difficult. So, when you heard he needed urgent medical help, you realized he had to go far away.
Yes, like Ottawa is like a second home for me. I delivered my first Noah here, and then a year and a half later, I delivered another baby that was premature. And then Noah, I have no family here, just few far distance and that are not close to me. And if I try to get help through medical, wanting my spouse or relative to come in, it was hard.
I can tell by your voice. So, what kind of medical treatments has he received?
He's been taking metformin for the past year.
And that
And
is for type 2 diabetes.
yes, for him to try and lower his weight down. And for now, I'm getting maybe in 2, 3 days, I'll be going for ENT appointment follow up with him. So from that, I'll find out currently what's going on with his ears, nose, and throat after getting surgery 2 years ago.
And then the other problem you mentioned is that probably linked to the diabetes, he's having problems seeing with his eyes. What did they tell you is happening there?
His left eye is basically almost blind, and he was prescribed with glasses 2 years ago, and he is a big baby, like big kid. I myself is like 140 pounds, and he's like 160 pounds, 6 years old.
This is a big, long journey for you.
Oh
Um,
yes.
has the clinic there at CHIO that is trying to facilitate this medical treatment and travel that's involved helped you at all?
Yes, they've helped me and my boys a lot. So my middle kid was left alone up north with my parents for almost 2 years when Noah was coming down here for medical on and off.
And so is he still there or is he with
No,
you now?
they all came down in November. So everyone, all my three boys are here now with me.
Excellent. Do you want to go back home to Nunavut?
No, no, it's too much. Why bother being up north when Noah has health issues and I wouldn't want to lose another kid. No, I have a job, full-time job here now. So
Oh, you do? What
yeah,
what are you doing
I'm
for work?
taking care of Nunavut clients that are coming here for medical.
Well, that is certainly appropriate, right?
Yeah. Yes.
So you know what they're going through.
Yes, I do.
And one of the reasons we're doing this podcast, Paul, is because we're talking about the travel burden. What do you want people to know? I mean, about solutions.
To make sure, even though a small community, to have a available doctor most of the time. Because what I can say is we have maybe 26 communities in Nunavut, and there's only one city that we have to go fly down for medical.
So one of the solutions you would say is more health professionals, doctors, nurses, nurse practitioners in more
Yes,
communities.
yes.
How urgent is it?
It's for my community. It's been urgent for the past 5 years. After the nurse in charge, who was working there for 20 years, retired, they can't find any nurse in charge because of the hours of availability and how far it is.
You're dealing with people who come down from Nunavut for care. Are you seeing some very troubling stories about what the lack of care or the difficulty getting it is
Yeah, it's
causing people? Yeah, give me some examples.
like most of our clients for the past 2-3 months is like from a town Clyde River. So that community needs to be more improved, more taken care of, even though it's a small community. And lately, more babies being brought down here during winter time is what I noticed. And
With
then
RSV or
yeah,
pneumonia?
RSV, pneumonia, babies from newborn to 2-year old is what I've been noticing.
Got it. So it's really primary care you're talking about that they
Ye-
need more of so that they could prevent some of these things.
Yes,
Do you feel that the Ottawa, the hospital, the Children's Hospital of Eastern Ontario, CHIO, has been more culturally sensitive to you and your family's needs?
yes,
And that helps?
it helps a lot.
Why?
More people like nurses and health professionals has more understanding of my family.
Do you feel hopeful?
Oh yes, I do.
What's your hope?
My hope is to get better health benefit to kids up north sooner than later and have a wonderful life. Just be grateful for how far you can go through, even though it gets really hard at times. I've gone through so much, but I'm still surviving. I'm still standing. Just keep having a good faith and hope. If you can't do that, talk to someone. Just let it out. Don't keep it inside, is all I can say.
Thank you so much, Paula. From the bottom of my heart, I really appreciate it.
You're welcome.
CIHI's data shows that some provinces like Ontario and Quebec have the lowest travel burden, while those in Northern Territories have rates up to 14 times higher. This data is important because it can help provinces and territories decide where services should be located and how to better serve patients. Our next guest is Dr. Radha Jetty, a pediatrician who, for a time, worked in Nunavut. She now leads the Inuit Child Health and Nunavut program at CHIO. She's also one of NOAA's physicians. Thanks for coming on the podcast.
Thank you for having me, Avis.
What do you see in terms of the challenges and the difficulty of having to make this move and be somewhere else for a year or two?
It's very difficult. Inuit children, their families have to leave their home. their support systems, their land, their culture, their families, and access care in an environment that is so far from home. There may be other challenges in terms of cultural differences, language differences, and not just challenges in support. They're also not able to always maintain employment. And so that means that financially, they're also very stretched. Having a Nunavut health card and needing to live outside of Nunavut may also provide some barriers in terms of accessing certain services that may only be provided or easily accessible to Ontario residents. So we also need to understand the complexities of what it's like to access care outside of your home territory.
Your own story started a few years ago where I think you had this fork in the road where you could have gone and practiced medicine as a pediatrician somewhere else, but you chose Canada's north. Why did you make that choice?
Well, it was really interesting. I always had this desire to, to try to provide care to those who need it most. And at the time, I was very interested in traveling and working overseas and working with individuals, families who are very vulnerable or experiencing high vulnerability and high levels of health inequity. However, during my training, I had the opportunity, both during medical school and residency, to go to Canada's north,
To Nunavut.
to Nunavut. The first time was actually in northern Quebec in Puvornituk. And the second time, as a pediatric resident, I had traveled to Iqaluit and lived and worked there for 1 month during one of my rotations.
What did you see?
Well, it was during that time that I realized that I did not need to travel and cross an ocean to provide the care to individuals who need it most. We have individuals who are experiencing significant health inequity right here in Canada, right in our own backyard. Children and families who experience such significant poverty, food insecurity, children who live with high levels of medical complexity, with high levels of medical fragility, who do need to access care, at pediatric centers like CHIO. And so it was during that rotation that I realized that I wanted to stay here in Canada and do the work that I needed to do right here at home.
Fair to say it embedded itself in your heart.
Absolutely. And I think when I finished my training and I had the opportunity to actually create a position for a pediatrician in Nunavut and make Iqaluit my home for a few years, it was a very special time in my life.
Wonderful. When you were there, you saw the burden of having to deliver healthcare up there, but also what it means for patients. And part of what CIHI has done in this report is looked at the burden that 1 in 11 people, this is all over Canada, have this burden of having to travel somewhere for care.
We definitely saw a lot of children who needed to leave Nunavut to access the care that they needed. I can remember a case where there was a child who was diagnosed with leukemia, and children who live in rural and remote areas often need to leave their homes, not only for weeks or months, but sometimes years. Sometimes they're not able to return home altogether if their medical situation is very fragile. And we worked very hard to try to be innovative and try to provide care closer to home. And I think that was the exciting part of living and working in Iqaluit at the time, and trying to be creative and, develop new models of care that could potentially keep kids and their families together close to home.
And that led to the clinic at the Children's Hospital of Eastern Ontario. Pronounce it for me, and what does the name mean?
So the clinic's name is the Akuluk Clinic. Akuluk is a term of endearment that, parents will often use with their children, with their family members. It's a term of affection, a very warm term. And we wanted to use this name for our clinic to, to highlight the level of care and concern that we have when we approach families who are far away from home, needing to access care here at CHIO and in Ottawa.
What do you do to help them ease this travel burden from Nunavut to Ontario?
For over 25 years at CHIO here, we've been caring for some of the most medically and socially complex children from Nunavut. We also have been working with a number of partner organizations here in Ottawa who also provide care and met the unique needs of Inuit children, their families from Nunavut.
How do you know that it's easing the burden of this medical travel?
I don't know if we can answer that particular question. Our clinic really is trying to support the children who have to be placed in medical foster care due to their fragility and are separated from their families. And so we are really trying to support both the families of origin and the foster children and the children who are in that care. And we also provide care to families who are detained in Ottawa for long periods of time. And so one of our priorities is to try to help children and their families be repatriated back to Nunavut as soon as it is possible.
Mhm. And you've helped bolster the clinic up there. At the time you were there, you were the only pediatrician.
So that's right. Back in 2008, there was no full-time pediatrician position in Iqaluit, Nunavut. And it was important for me to try to explore, to advocate for the creation of a position for a full-time pediatrician and to develop a formal pediatric program. And now there isn't just one position, but multiple positions, multiple full-time pediatricians who call Iqaluit home, which I think is a great success.
Does that make you feel?
I feel very happy. I guess the reason why I'm hesitating is that I think it was a long time coming. I think that it takes a lot of work to ensure that we provide equitable care. And, I think there's a sense of satisfaction that we are moving forward. I still do feel very strongly that we still have a long way to go as well to really, truly provide equitable care.
You and your team conducted a study to see how this program and this transfer of patients between Nunavut and Ottawa is working. What did you find?
Yes, so we did this study to try to understand what were the strengths and the challenges of the Akluk Clinic. We were very happy to know that many families felt that families and providers felt that the clinic was working towards trying to include Inuit culture and language into the care provision, that we really focused on trying to build trust, that we were trying to develop long-term relationships with patients as well as other providers.
Do you think this is a recipe for easing this travel burden?
I think part of the burden of travel is the challenge that the families experience when they are so far from home. And they're in an environment where there's a different culture. They might be experiencing racism. There is a difference in language. And
Mhm.
all of this creates a significant amount of stress for these families. They might be experiencing depression.
Must be hard, right? They're there not because they want to be.
Exactly. And, we also hear from other institutions in the city, hospitals, the boarding home, the Ottawa Police Service. They've reported high levels of safety concerns as a result of this distress. And I personally have worked with families and, seen families experience the consequences of not being supported during this distress. There was an unfortunate suicide of a parent during this unfortunate time. There was a situation of child abduction. I worked with a family where, unfortunately, there was a situation of sexual maltreatment of a child while they were unsupervised. It's a very stressful environment to be displaced when they have to access the care that they need. And the families don't have a choice.
Like these events that you talk about happened before the clinic officially existed.
Well, you know what? They're still ongoing, but we do find, and that's what we see from the data of the study, is that the families and the providers are experiencing more support as a result of this clinic. So I think we're doing something right with the clinic, and we would like to ensure that we have the resources that we need to continue moving in the right direction, and providing the care that the families need. But we still have a lot of work to do.
It sounds like it's been a win-win in the sense that the clinic, Nunavut, has more pediatricians because of it, but also you're able to give people, when they come here, more support.
Yes, I feel that, in the last few years, we've made amazing and impressive gains. And that's why data is important. And when we develop innovative models of healthcare that are providing positive results, we need to be able to accurately study that, track that, report that, share that, disseminate those results. And we hope that, other centers will be inspired by, the success that we've experienced. And I'm excited to potentially even have collaboration across the country to try to create more robust models of healthcare.
Thank you so much, Dr. Jetty. Appreciate it.
Thank you, Avis.
Dr. Jetty will be presenting data on the successes of the clinic in the coming months, trying to show the value of a service to help bridge the distance gap and help Indigenous and remote patients get proper and equitable care. And there's much more on the Travel Burden Report on the website at CIHI.ca. That's CIHI.ca. And please subscribe to our podcast on your favorite player. I'm Avis Favreau. Talk to you next time.